process of doing a hospital first receiver decontamination course. Basically what this course allows us to do is to ensure that our patients that are involved in some sort of contamination, spill, have been contaminated by some sort of substance, unknown, known, whatever it may be, that we can adequately and safely care for them after they've been decontaminated in our hospital. What we're training for here today is something that would be on a much larger scale, where we would be decontaminating probably 10 patients or more. And for us to be able to do that, we have to have some sort of organization to the process. So patient gets here, they're considered what we call in the hot zone at that point. We take them through the shower, which is known as the warm zone, and then on through to the cold zone, which is the area where everybody can have access to them and they can be absolutely safe and not have to use the appropriate personal protective equipment to take care of them and do blood pressures and do all of the normal medical things that you would normally do. We've had several instances in the past where, we've had unknown substances, chlorine exposures, chlorine gas exposures, ammonia exposures, exposures to agricultural pesticides and things like that, where this process becomes very useful to our hospital. There is nothing that replaces this hands-on activity. You could tell we have real live victims here who have volunteered to be a part of this. This is the best way to train, in my opinion. Getting the actual tools that you're going to actually use in a real event, having patients who are moulaged and have chemicals on them is the way that is best to do this type of training. We have everybody here from nurses to first responders from other communities. There's approximately 25 Bryan Health employees here today training on how to get rid of these substances. And then in addition to that, we have various people from different organizations within the community.
Bryan Hospital is extremely proactive in their emergency management program. They have put in a considerable amount of time training their staff in incident command. They've put in a lot of time with their emergency operations plans. They really are setting a really good examples for hospitals as far as what they do for preparedness. And their hospital just really does an outstanding job. Their leadership is very supportive. I wish every hospital in the state of Nebraska did as much as Bryan Health.